Hi, everybody. Welcome to today's Jerusalem Connection Red Alert Report. I am your host, Amy Zawi. Today we have joining us from Israel, Gila Zarbiv. She is with Magen David Adom, and she is a midwife who works with women having babies. And the reason why we want to bring her on this program today is because this is an important service that the emergency services of Israel supplies. And I believe her story and her experiences are something you all will really connect with and enjoy hearing about, and then want to learn more about and even help support. Gila, welcome to the program. We're so excited you're with us. Most of our audience, in fact, all of them, I'm sure, love children. They love to hear about births in Israel and the success of the growing population, and they just love children. So welcome to the program. Tell us a
Thank
little
you.
bit about yourself and your journey. How did you get to Israel? How did you get to be a midwife? Before we get into what you do and your experiences, we'd love to learn a little bit more about you.
Well, first of all, Amy and everyone here listening, thank you so much for having me. It is a profound honor to be here. So my name is Gila Zarbiv. I'm originally from Pittsburgh, Pennsylvania, born and bred, as they say. And I grew up in a very Zionistic house where Israel was constantly talked about and discussed. And we were, always going to visit. And it was always something that we were aiming towards. The first time I visited, I was 8 years old, and it left a real mark on me. And I knew this is where I want. From that moment, I knew this is where I want to live. This is where I want to raise my family, and where I want to put down my roots. I told my parents the day after I graduated college that I was moving. Like that was that. I moved here. I met my husband the week I arrived, and we have 4 beautiful children. He's an oncologist. We met in the hospital. We both went to the same hospital. We both worked in the same hospital. I'm in Hadassah in Kerem. All our children were born in the same hospital, except for one that didn't make it. And I always knew that I wanted to be a midwife in Israel. I always knew that I wanted to be part of something bigger than myself. I didn't just want to help women, babies, families, communities grow and thrive. I wanted to do it in Israel, in my homeland with my people.
Wow, that's beautiful. That's beautiful. So, how did you then get involved with Israel's emergency response system, the Magen David Adom organization, and was the services of midwives being able to go out on calls, was that something that was an initiative that was already existing, or were you part of it? Tell us that story about how that need was identified and you and women and like yourself got involved in the emergency services program.
So that's a really, really amazing story. So I had the unique honor to be on the board of the Israel Midwives Association. I was working with exceptional people. Yifat Obanenko was the president, and there was Tanya and Yuval and myself. And we were all there to essentially promote, progress, and enhance midwifery care for the women and the families and the people of Israel. It started essentially before it predates the war. And in the days of COVID-19, we started realizing that things were shifting when people, and this is a global phenomenon, people were afraid to go to the hospitals. People were having more babies at home. People were becoming really cautious and concerned. And that led to conversations that we need to be able to give emergency care to women wherever they are. I don't know if you're aware, but according to the WHO, midwives are supposed to or should be caring for up to 90% of the scope of women's health. It's called sexual, reproductive, maternal, neonatal, and adolescent health. They call it SRM-NAH. And we wanted to create that for women in Israel because it was lacking here. Midwives are primarily found in the labor and delivery ward. So when the war started, and it became really, really crucial that women in the peripheries were actually unable to make it to the hospital under threat of bombs falling or terrorist attacks or other horrific things that were going on, it became essential that we were able to provide them with midwifery and maternal health care wherever they are. Midwives save lives. Every woman deserves to have a midwife by her side. And that was the impetus for us to create this event. This program was established in 2024. Since then, a new board has taken over. There's a new president for the Israel Midwives Association. There's Tanya, and Yuval is the CEO now, and they're continuing to run it. But it's a beautiful initiative that we see actually results in saving lives and women having access to midwifery care across the country.
Wow, that's amazing. So you saw a need and you stepped up to meet it, and that's a wonderful thing. So can you tell us a little bit about what's the difference? I mean, it may seem obvious having a baby in a hospital. People are used to in America, your labor's starting, or maybe you schedule your delivery, right? Nowadays in America, people seem to make appointments to have their babies. That environment versus the uniqueness of somebody calling from a location, or a family member, a husband or other family member calling from a location because there's a situation going on and they can't get to the hospital. Are you able to share any stories or circumstances that illustrate how this program is saving lives, and the uniqueness of these stories, so that we can just be inspired by them, and really urged to participate and help and learn more as best we can from our side of the world?
I can share so many stories. Would you say we have 12 hours now to tell stories? Amazing. Everybody, make a cup of coffee, a cocktail, and sit down. Cup of
That's
tea.
right.
No, it's interesting because first of all, it wasn't just myself who implemented this. There was the entire association and working together with incredible people in Magen David Adom. So I want to be very, very clear. This is the work of many exceptional people. I just happen to have the honor to be slightly involved. It's interesting because it seems like something theoretical, right? Like it's this concept of like, okay, it would be so great if a woman is having a baby at home, or it's not just for women having babies, it's for the entire continuum of women's healthcare, for them to have a nice midwife by their side. And since I've joined, I see that it is anything but. You can actually see the difference in actual numbers. I recently had a call with a woman who was 33 weeks. That's early. We're supposed to deliver around 38 to 40 weeks. So her baby was preterm. And the call came in and she was 6 minutes away from my home. So I went running and I arrive at my home, this woman's home, and I see that a baby was essentially coming. She was going to be having this preterm baby at home. Now, paramedics and medics are amazing and they know exactly what they're doing and they do exceptional work. But the difference between having a midwife and a paramedic is that paramedics are now going to treat that situation as an emergency situation, whereas a midwife has the ability to understand what is physiological, when that physiological then becomes pathological, and when we need to intervene or take other steps, and when we can just as we say, let nature take its course. So the only concern is that this woman is having a preemie baby at home, but in terms of the birth, no one needs to freak out. Like everybody can calm down. So we dimmed the lights, we talked in low tones, we heated up the house, we placed her in the position she wanted to deliver on all fours. I flipped her on all fours. In one push, a beautiful baby girl was born, crying, and the paramedics like, let's go, we have to go. And no, we don't have to go. We put the baby on her chest, skin to skin. We kept everything calm, waited for the placenta. Like it's the ability. One of my favorite statements to say is that birth can be difficult or can be scary, but it doesn't have to be traumatic. And I think that really is the significance of having midwifery professionals in these environments where birth may not have been expected. You asked about the difference between having a baby at home and having a baby in the hospital. So clearly, this isn't a planned home birth. I'm in my final year of my PhD at Ben Gurion University studying health systems management and policy. And what I'm actually looking at is how the system works and how we can implement more midwives. And one of the things that we see is home birth is essentially, it's safe, if not as safe as hospitals, maybe safer. But the difference here is those are planned. Like you said, those are planned home births where the woman has her family around her and her midwife coming with her and her whole environment. And when something unexpected happens in birth, it's not hospital versus home. It's the planning versus the unexpected. And that can be a little bit scary. And having someone who comes and says, hi, my name is Gila. I'm a midwife. I will not be leaving you. You're okay. Everything's okay. I think having someone whisper that in your ear, having the tone stay low, the lights go down, nobody's panicking, that in and of itself prevents trauma. I also have the ability to stay in touch with these women. Every single woman that I've been with, I stay in touch with. I get to speak to them after and create that continuity so I can see how they're doing. And those are things that aren't really able to happen when you have standard paramedics and medics who are in the field, that follow up and that continuity. Another really important story that I had is postpartum care. I was getting in bed. I was all snuggly in my pajamas. I'm always in my pajamas. It's like they're waiting. I'm all snuggly in my pajamas. And I got a phone call that 3 minutes away in a Muslim community right down the block from me, a woman was postpartum, was having something called preeclampsia. I didn't know what that meant because it had said, I didn't know if it was pre or post. I didn't understand exactly what they were referring to when they said preeclampsia, but that's what the call was, preeclampsia. Preeclampsia is a disease of pregnancy, of hypertension, and it can be fatal. So I arrived at this house not exactly understanding, was she before, was she after, not exactly knowing what they meant by preeclampsia. And I come to the scene of a woman who was postpartum, which is very rare, who had given birth a few days ago. And she was in her home, in her bed, with a blood pressure of 200/100, which is severe hypertension. She was already having neurological symptoms. She was having trouble speaking. She had a debilitating headache. She couldn't open her eyes. She was really on the verge of a life-threatening situation. The paramedics who arrived were amazing, but the midwifery aspect that I was able to, give them access to a vein, whisper to the woman what was happening. I was able to teach some paramedics about preeclampsia and about the outcomes and the significance and the signs and symptoms. And I glanced over at her child, and her young newborn infant was jaundice, which is not something that I don't think other people would have noticed in terms of looking at the woman as a holistic being. So these aren't just nice things to have. Every single woman should have postpartum care by a midwife in her home. Every single one should have prenatal care. Every single one, wherever she is, should have access to the highest standard of care. And this program, this initiative allows that. It integrates it into the system, it's not something you can even quantify. It is such a beautiful, beautiful initiative and so crucial for everyone.
So help me understand, since I am not a medical professional and most of our listeners probably aren't, we just know what we've seen on television programs or the babies we had ourselves, which were oftentimes, thankfully not traumatic or crisis driven. So if you have these paramedics that are consummate professionals, and I'm sure they're trained in a variety of situations, I'm sure they know the mechanics of childbirth, you know, things like stopping bleeding or what have you. So when you come in alongside that, you're not just there to model and teach these paramedics something that maybe they can take away and use another time where maybe they happen upon a situation where the midwife is not there yet, or perhaps not able to get on the call or get theirs quickly. So, what is your experience working with the response professionals as you come alongside them? For example, you mentioned that the paramedics in the one story, they were like, we gotta go," but you're trying to de-escalate any sense of urgency when there's no urgency needed, and are you able to articulate in a peaceful way that doesn't scare the patient or alarm the patient if there is an escalation that you need something more equipment or more resources than perhaps is available at the house or in the ambulance?
That is such an amazing question. It's very multifaceted. So the first thing is that one of the beautiful things that Magen David Adom is doing is that it's creating a midwifery training program, i.e., it's taking midwives from across the country and installing them inside the paramedic training courses, and we are now training the paramedics. So they now have midwives actually training the paramedics with regards to all aspects of women's health. And it's important that we remember that this isn't just about pregnancy and birth. Midwives are so much more. They're 90% of the women's healthcare continuum. So midwives should be wherever the women are. I one time had a woman who was 23 weeks pregnant who was scratched really badly by a cat, and the paramedics don't know necessarily about toxoplasmosis and about other aspects. So even these small things that seem perhaps tangent or not related, they're definitely the place for midwives to be. So the first thing is that the midwives are there directly with the training. And the second thing is what happens on site. How do we work together, and how do we necessarily keep calm when maybe not all is calm? This isn't just a out of hospital question. This is a birth and a chaotic environment question of how to maintain calm when things may or may not be going according to plan. And I think that the very, very first thing is the aspect of the midwife. And I know I say this a lot, but on my very, very first call here, I responded to a woman who had actually already given birth. And I walked into the room, and there was, I'll never forget it, there were 4 paramedics, there was like 5 medics, and this woman was refusing all care. She didn't want to be checked. She didn't want her baby checked. She was very overwhelmed. Most of them were men, and this was an ultra-Orthodox, very religious woman who was not comfortable. And I entered the room. First, when I arrived at the scene, the relief of the paramedics, oh, there's a midwife here. And I was very surprised and encouraged to see that. They themselves removed themselves from the room. They moved me forward towards the room. I said, "Hello, my name is Gila. I'm a midwife." And everything changed when I said that, because she doesn't know necessarily what the scope of a paramedic is or what the scope of a medic is. But this is her 6th birth, and she knows what a midwife is. And she immediately, without hesitation, the first thing she said was, "Do you cost money?" And I said, "Absolutely not. I am free of charge. I am a volunteer, and I am here to help you, and you will not get charged for anything, nor will Magen David Adom." And everybody went out of the room, and she allowed me to perform a full comprehensive postpartum exam, checking for tears, checking for bleeding, checking her baby, doing a full debrief of the birth as soon as she heard it was a midwife. That in and of itself reduces the panic. As soon as they hear that there's someone here, a professional that they recognize what that scope means, it immediately causes calm. It's also the way that you communicate and the way that you hold yourself and the way that you communicate with the woman. When something goes wrong, it's about explaining and readapting. In terms of resources and what resources we have at the scene, it's the beauty of working within these teams of paramedics and medics is that when everything goes great, we have all the time in the world. When everything goes wrong, they're expert at what we call, the scoop and run. We can calmly move her to an ambulance and continue. I had a birth recently where I arrived at the scene. A woman was 8 centimeters pregnant. We gave her, she tried to push one push. We weren't delivering. Our goal, clearly, she wants a hospital birth. She doesn't want home birth. It goes by her wishes. We moved her to the ambulance. I went in the ambulance with her, drove all the way there. And in case she needed to have a baby, we would have pulled over and would have delivered her right there. It's this ability to adapt and respond. So it's not necessarily about lack of resources or handling things when we don't necessarily have the right materials, but it's more about our ability to adapt, respond as we need to respond, and work as really well-oiled machines and as a great team, which is part of where the midwife's education comes in.
So that's an amazing thing. You're able to pivot quickly and just assess the situation and calmly without a panic, even though there might be a sense of we need to get from one place to another, and do it quickly in a manner that keeps the woman comfortable and calm. So I've also want to think about, you mentioned a few different stories so far, and what I'm hearing is, and I love this about Israelis, I love this about the society, certainly about Magen David Adom, your services and your heart for these situations in all the aspects of women's healthcare, it transcends any ethnic identity, any community. I mean, I'm assuming that most of the midwives who are volunteering for this or part of this program serve an area that is in a geographically close to where they live so they can get places. But in your network, I'm sure you have women that then are from the north all the way, from Matula's area down to the Gaza envelope, and you're also dealing with a variety of communities. Can you tell us any experiences, whether they're yours or your colleagues, in taking that initiative to serve all the women in Israel, whether they're Druze, Muslim, Aramean, Jewish, of course? What is the diversity and that scope? Because I really want our audience to have the information, the concrete firsthand information that you can share, that Israel is not this myth and this libel that is out in the West, that it's apartheid or discriminatory or prejudice against the non-Jewish community. Let us debunk that together with what you're doing and the midwives of Israel are doing for all the women that are choosing to pick up the phone and call that service or reach out for help.
I would be honored to debunk that together. It's one of the most pervasive misunderstandings or purposeful misinformations that happen to do with Israel and the way that I work. So I want to start out by saying that I work with everyone. We have Muslims, we have Christians, we have ultra-Orthodox Jews, we have non-religious Jews. We serve everyone. We have never, ever in our lives received a call or in the hospital and said, wait, 1 second, what are your political views? What religion are you? What is your race and your creed? And I think that medicine in general, but specifically in the fields that I work, I call them oases of peace. First of all, we work with everyone. We work with Muslims, with Jews, with Christians. We serve everyone. We serve Muslims, Druze, Christians, ultra-Orthodox, non-religious. And the work that we do, I call it an oasis of peace. And I call it that because never once do we ask anyone any other question other than, how can I help you? And I think that if the world functioned the way that medicine functioned, the way that emergency services functioned, we would be in a much better place. And I want to tell you 2 quick stories. I once had a woman arrive in my hospital shift. She was 23 weeks. She arrived from the West Bank. She didn't arrive from Israel proper. And that's the first misnomer or thing that people don't realize, is that I personally have treated women from Gaza. I've treated women from the West Bank. I know that my husband has treated people from Syria and outside of Israel. He's an oncologist. So I have seen genital mutilation from Africa to, wealthy people from New York. It is all inclusive. Sudanese refugees and lesbian beautiful couple from Tel Aviv. And I think that isn't necessarily, it's not understood. It's not talked about enough. I had this beautiful woman come from outside of Israel. She was 23 weeks, and she arrived in Hadassah after bumping from hospital to hospital, looking for a place that could deliver her because her baby was so young. When she finally arrived at my shift, it was a night shift. She ended up in my room, and I was the first Jewish woman she had ever met. I'm going to
Wow.
fast forward that this beautiful baby not only survived, but thrived. And I stayed in touch with her. I went up to the ward afterwards and I would sit with her in the NICU, which is the neonatal intensive care unit. And I don't speak Arabic and she doesn't speak Hebrew. And we would speak this language of compassion, this language of care, holding hands, sitting with each other. And I'd like to think that, when she went back to where she's from and she met one Jew for the first time in her life, that this is how we build these bridges. This is how we make change. But if there's anything that I wanted to tell the people outside of Israel, is that that's what Israel really looks like. It's not me. This is what everybody is doing. All medical professionals around this country, not only treating everybody, but working with everybody. I work alongside Muslims and Christians and Jews, all of us together for the greater good to help people be better and make them okay. And I think that that is such a crucial message that somehow we all need to get out there. And the world needs to function more like the medical professional, and I wish it would.
That's amazing, and it's what I am so I know it, I've witnessed it, I've been to Israel several times, but it's just so important that exactly what you said, your experience, your reality. Not only are you treating patients, and folks, whether they're Israelis or visiting from another place or traveled in from another territory, you also mentioned that your colleagues are as diverse as your patient population and that everybody is working together. They have their heart for healing. And your husband in that oncology department and you in midwifery and women's health. I think it's so important that everybody get those firsthand experiences from people such as yours and are able to retell that story because the news cycles here, I'm not sure how often you come back to America or how often you have the unfortunate opportunity to read US news stories in the mainstream. It is really an untold story that we at the Jerusalem Connection want to have as many folks as possible, your voices heard, and that reality expressed so people understand what Israelis are going through and the heart and the culture and the society. So we really appreciate your sharing that with all of us. And your testament that this is also the perspective of your colleagues, right? It's not just your one outlier of a medical professional, but this
Yeah.
is really the industry. And uh, and we just really appreciate that about Magen David Adom and the entire Israeli healthcare system, as well as the rest of the industries in Israel for the safety and well-being of the community members. So the website to learn more about Magen David Adom and even to donate is savinglivesinisrael.org. Savinglivesinisrael.org. We're going to share that. Gila, is there anything else, any other stories, anecdotes, or messages you want our community here in North America to know and understand? We are a praying bunch of people, so we are going to be praying for you and the women you touch and the lives you touch, for your own endeavors in your PhD program, your family. You have a beautiful family, a big family, so your attention is everywhere, and it's like you're just this exponential, repository of love and care, and it just really inspires us. So is there anything else you want us to know, or maybe one or two more stories that you found profound that you'd like to share?
I would love to. The first thing I want to say is thank you because we're feeling profoundly isolated. I'm not speaking for myself only. I know that our country is feeling profoundly isolated and there's so much misinformation and it's so prevalent. It's everywhere. And these stories are not told. These stories are not told that my midwife friends, my colleagues, and my physician friends, and the cleaners in the hospital and the secretaries are leaving their homes under fire, under actual missile fire to save lives of human beings everywhere. And I think that your support and the support of your listeners is so appreciated. It gives us hope. It gives us hope that maybe our voices can get out there, our stories can be heard, and there is justice. That there's two sides to this story. And of course, war is horrific, and it's horrific what is going on in Gaza and in Iran and in the Sudan and wherever war and disaster and crisis is taking place. And I dream of a day that I can work side by side with my Palestinian midwifery colleagues and that we can work in peace and in harmony for the betterment of women, their families, and babies everywhere. But until then, until that moment, we'll continue to save lives and continue to be there for women. I think a powerful story that people can benefit from hearing is how multifaceted this country is and what it looks like to work in such a diverse environment. And in one shift, one hospital shift or in one ambulance shift, I can treat a woman. One day I arrived at work and I treated a woman who was having her 18th birth.
Oh,
She turned to her husband and said, just one more, one more. And he said, okay. And it was twins. So she was having her 18th birth of twins. And it was the most beautiful, peaceful, gorgeous, gorgeous birth. And in that same shift, you can work. I worked in triage, and you can have a woman come in, and she was a beautiful, beautiful Muslim woman with a white hijab and bright blue eyes. And she came to us because she wanted asylum, because she was in an abusive relationship and she was coming to ask us for help to get out of that abusive relationship. And in that shift, we can also have and these are all true stories. We can have a beautiful, exceptional Christian woman who I will never forget, who knew, I'm going to try not to cry, who knew that she was giving birth to a child with trisomy 18, and the child was not viable, but she was a devout Catholic woman. So she would not have done any type of abortion or any type of, anything to stop the pregnancy. And she delivered her child. And to her request, she had to have a C-section for a previous history, but at her request, a priest was brought into the OR, which is not something that's commonly done, and he blessed the child as the child passed away on her chest. This is all happening in the same tiny ward where we treat the same women and the same families. It is so diverse. We will have a woman from Ethiopia who only speaks Amharic, and this is her first birth in a scary country, and you need to communicate her with no words. And the second you walk in the room, you need to explain, you're safe, it's okay, I'm Gila, I'm a midwife, I'm not leaving you, it's okay. Without the language, you need to communicate with your hands, with your compassion, with your professionalism, with your knowledge. And this is all happening on the ambulance, in the hospitals, in the streets, in birthing centers, in homes, across Israel, in such a tiny, tiny space with so many different humans. And at the end of the day, it's just like you said, Amy, it all comes down to humanity. It's just people working for people, with people, without ever asking, who are you? Where are you from? What do you believe? But just, how can I help you? And that's definitely something that makes Magen David Adom special, that I'm honored to be a part of. And it's found in all aspects of healthcare across this country.
it's a beautiful thing, and it's such an inspiration for us to hear, and it's just the kind of information that we all need on our end. We need it on a platform, we need it recorded so that we can share it and share it and share it and tell people, "No, what you're reading in the news is wrong. Here's an example," and someone can share this interview or another interview with someone else from the system. So we're so grateful and appreciative of your time to share what you're experiencing and what you witness and the reality on the ground in Israel. And again, everybody, it's savinglivesinisrael.org. Please go to the website, learn more about the variety of efforts and programs and services. I mean, Magen David Adom also has the blood bank and other life-saving measures in addition to the EMS, the emergency response system. And we all need to be champions for it and supporters of it. And having folks like Gila and her colleagues on our program to share those experiences really be inspiring us to participate and come alongside how we can here in the United States and in North America. Gila, thank you so much for your time. I know you have a busy schedule and a lot on your plate. And again, we are so grateful for this opportunity to hear what you have to tell us.
The honor and pleasure were all mine. Thank you so, so much for having me. I'm very grateful for this opportunity.
Thank you. Shavua Tov.
Tuvah tov.
If you enjoy these conversations, please visit us at www.thejerusalemconnection.us. Find all our podcasts on YouTube or wherever you listen to your favorite podcast program. Follow us on social media, subscribe, like, and share our content to reach the broadest audience.